Thanks for staying with us. So, just recently, the increase in infection across the country has marked 100,000 in terms of the infection rate, making Nigeria the 8th most infected country in Africa. Join us on the show to discuss the nation's fight against COVID-19 pandemic is the National Coordinator, Presidential Task Force on COVID-19, Dr. Sanni Aliyu. Good morning, sir. Are you there?
Good morning.
It's always a pleasure to have you on the show, sir.
Thank you. Thank you for having me.
Right. So the update, obviously, of COVID-19 pandemic is the fact that this second wave is on, and the new strain is quite dangerous, and many more people have died in recent times. Could you give us a quick overview of the reports and the data you have concerning the new strain of COVID-19 and how it's been, how your team is working to combat it?
Well, first of all, let me say that we haven't confirmed that we have the new strain in Nigeria yet. We have been sending samples off to Redeemers University for the sequencing, but we haven't got those results back. So just really to confirm,
we can't hear you very clearly. I want to speak a bit louder, please.
Can you hear me now?
Yes, clearer.
Can you hear me?
Yes.
So as I was saying, I just wanted to clarify that we haven't confirmed the new strain, the UK or the South African strain in Nigeria yet. We have been sending samples to Redeemers University through NCDC, but we are yet to get those results. Having said that, there's no doubt that the numbers have been increasing. We have now crossed the 100,000 mark. We have just over 1,300 deaths. And remember, we are under testing, so there is an underestimate. Even though we say we have about 100,000 cases, we know this is far more than that. For every one positive we get, we are missing between 7 to 10 cases. So that just gives you the idea of the extent of the transmission of the infection. And what's worrying us really is the fact that our treatment centers are now starting to get overwhelmed. Here in Abuja, for instance, we have to struggle to get places for people requiring beds for oxygen or for ventilation. It's really becoming tight. And the impact of COVID-19, the worry about COVID-19 has always been about the impact it will have on our health system, i.e. the difficulty, the challenge that people might have with ordinary diseases like malaria or severe respiratory tract infections or even typhoid, for instance, not being able to access medical care simply because the health system has been overwhelmed. So the impact in terms of mortality, in terms of death, could be quite significant indirectly, as we saw in Kano, for instance, back in April, May. What are we trying to do about these cases? Well, we've continued to do a lot of risk communication and community engagement, but at the end of the day, it all boils down to people's behavior. Our risk perception. We really need to stop having mass gatherings. We need to be very sensitive to our environment and the people we meet. So, for instance, anybody I meet, I potentially consider that person to have COVID. And this is the best way to protect yourself. Make sure you wear a face mask, sanitize your hands. If you meet somebody who is not wearing a mask, please do not engage with that person. Insist that that person wears a mask before he or she comes close to you. And if you are particularly in a vulnerable group, such as the elderly, those with comorbidities like diabetes, for instance, these are the very people that the virus is after, because they are the people that are most likely to have severe illness. Based on our data, as I've been saying in the past, if you're above the age of 50 and you catch COVID in Nigeria, you have about a 1 in 5 chance of dying. Those above the age of 50, between 50 to 59, 20, between 19 to 23% of them died. And if you're above the age of 60, the statistics is even more dire. So while people might say that overall the death rate in Nigeria has remained low, but if you stratify this based on age, and you are middle-aged or 60 years or more, you are actually in a very risky situation if you catch COVID.
Okay.
Yeah, I was going to ask, because you said mass gathering and the likes is the reason for this spike. But I think I'm going to ask you this directly. I think it's the lack of government enlightenment. Because if you tell people And I keep harping on this. If you keep telling people, if you keep drumming it into their ears, they will know. If you keep showing them, like I saw a report on TVC on Saturday, where they went into the IDH and they showed people. I watched that. I was scared. If I wanted to go for a gathering the next day, I would have said no, because I watched it and I was scared. Don't you think that the government should take it upon themselves to keep on drumming it into our ears, because we're not going to listen? If we're not enlightened, it's the same way AIDS spread in Nigeria, because nobody was telling us how bad this thing was. So don't you think you need to adverts, not just adverts, going to the grassroots every day, every second?
So we really have done a lot of risk communication, but the problem with COVID is that it doesn't have the same shock factor as Ebola, for instance, or any of the viral hemorrhagic fevers. You don't see people dying on the street, bleeding to death, etc. And that's why people tend to feel that it's not a major problem. And then secondly, the majority of people actually remain well. You have two spectrum. You have those that have mild illness and will just have a bit of a cold, fever for a few days and then get better. And these are usually young people. And then you have the other extreme, where people become extremely breathless and end up dying. And you just don't know where you're going to be in that spectrum, because we've had elderly people having mild illness, we've had relatively young people, we've had a 37-year-old recently, Lagos, who died of COVID. So that shock factor is not there. But you're very right. Those of us in the health sector, we know what we're facing, and we see it every day. We see it from telephone calls. In the last few days, we haven't been able to sleep because of the number of people coming up with COVID and wanting to have beds within the FCT. And we have to struggle and phone around, etc., to try and get places for that. But you're very right. Survivor stories are so critical. We have done survivor stories in the past, and we will continue to do that. And we will also encourage the press to help us with this, because this is a joint effort. It's a collective responsibility. It's not just about government, it's also about our community leaders, our traditional rulers, our religious leaders, all lining up to inform the public that this thing is real. And if you catch it, you don't really know where you're going to be. You could end up being well, but you could also end up being in real extremes and dying from a potentially preventable illness. Potentially preventable illness.
Dr. Aliyu, early last year when this started, even towards the end of last year, one thing we heard over and over again was the reasons why we do not have the large numbers they're recording in America and Europe is because of our very young population. But now it seems that means, from my own layman's point of view, given the number of obituaries we're seeing daily, and it cuts across all ages, what has happened to that benefit of a younger population in this in the pandemic and the spread of the virus in Nigeria?
Well, it's still affecting young people predominantly. It's affecting people between the ages of 30 to 40 years, and that data has been consistent across the board, and it affects more of men than women for whatever reason. We are not sure. There's no doubt about that. But the people that are dying continue to be the elderly. We still have a few young people dying, but the majority are actually elderly. Look at the obituaries. It's mostly people 60, 65, 70, and if you probably investigate, you'll find that they probably have some form of comorbidity, such as hypertension or diabetes. It's really unusual to have a young person dying of COVID, even in Nigeria. But having said this, back in April, I remember having conversations around India. And we were all marveling at how India was going to get away with COVID, very few cases, etc. What happened? In India, it all went pear-shaped. And India now has one of the highest number of cases. I think they are number 3 or so, and second highest death rates in the world. So there's no doubt that COVID prefers the elderly, it prefers the frail. It's a virus that takes opportunity of immune systems that may not be able to overcome it. Because if you catch COVID, either of two things will happen. It's either your immune system kicks in and it gets rid of it, or the virus continues to replicate within the lungs and chews away the lungs, and people go into respiratory failure. There's no drug at the moment that interrupts that replication. No drug. Whether people talk to you about vitamins or remdesivir or steroids, etc., no drug stops that replication except your body's immune system. And that's where the problem is. You just don't know whether it's going to have a party in your lungs or your body is going to react to it and get rid of it straight away. And that's why it's so critical for us. The best way to survive this pandemic is really not to catch it in the first place.
Okay, let me go on
when you go out, that everybody is infected.
Let me go on a quick break. When we come back, we'll continue this conversation with Dr. Aliyu. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.
Thanks for staying with us. So we still have the chairman, Dr. Aliyu, with us from PTF, explaining to us exactly the updates on COVID-19 pandemic. Let me take a question from Nima before I ask mine. Go ahead.
So, sir, for me, one of the reasons why we have a spike is the body language of our leaders and our politically exposed people. Reason is because, aside the conspiracies that there's no COVID, most of these leaders are of the view that, are making policies that are working against the fight. So we have the NIMC right now, all their centers crowded because our government chose this time to make policies that would require people to be, cramping and crowding places, public places. And while we are locking down certain other, businesses, we left this one and required that, because I don't see the reason what's, so urgent that we decided this period when we don't even have a cure, a vaccine or anything on ground to expose our people like that. So how do you see the policy that requires us to get registered or get our numbers on the, added to our NIMC numbers added to our phone numbers?
So it's interesting you say that. We've actually been linking up very closely both with the National Identity Management Commission, NIMC, and also the Honorable Minister of Communication and Digital Economy. It's interesting you say this, but I didn't realize it until last week when I had a very long conversation with the Honorable Minister that order for NI numbers actually went out in February. And they've had people sitting down in their offices, twiddling their thumbs and waiting for people to come in and get registered. But of course, it's all our sort of last-minute rush. Here we go. The deadline is coming up soon, and that's what's causing the huge number of people congregating in their offices. We have looked at their processes. We've worked very closely with them. It's very clear if you get into their offices, it's actually pretty well organized. But the problem is outside these offices. And we will continue to engage very closely with both NIMC and communications to make sure that there are enough security people, enough staff members to make sure that the crowds are controlled outside. But definitely, what I want to say is when it comes to protocols, when it comes to health, there's nothing like a VIP. COVID-19 does not differentiate between whether you are a rich man or a poor man. It really doesn't. If it's going to kill you, it will kill you regardless of how much you have in your pocket at the time. So this is a collective responsibility. We've seen it in other countries where the leadership has sent very mixed messages. I don't want to mention the countries, but we all know those countries. And what's happened? We've had a huge number of cases.
Is there a possibility
we really need to work together, both whether it's NIMC or it's any other government agency. Our rules apply across the board. We are a presidential task force. We are a national body. We've also been linking up with the state governors. The Nigeria Governors Forum, for instance, Governor Okowa's subgroup, has been working very closely with us. We meet virtually every 2 weeks, and we go through all the issues, including what we need to tighten, what we need to relax, and how the state government can come through. But at the end of the day, we have our protocols, and if it comes to our attention, we always reach out to speak to the relevant government bodies to make sure that our protocols are respected.
But Dr. Aliyu, it is a fact that the protocols at the NIMC centers presently are not being obeyed anywhere. Even their strike that just got called off got another crowd yesterday. Is there a possibility the PTF would direct that registration should be put on hold and the deadline shifted even further till we are at a place where we think it's okay to try to do this? Or a different method of registration is done?
So we definitely need to work together. I know NIMC has closed some offices where they've had problems, and whenever we see these issues, whether it's online or on TV, we pick up the phone straight away and speak to the relevant authorities. We don't shirk in that regard, and they know our feelings clearly. But we'll continue to work together to make sure that wherever the risk is there, it's really dealt with straight away. And as far as our protocols are concerned, NIMSI has our protocols, and I know they are trying within their office space, as I keep on saying. The problem is outside because of the crowd that keeps on gathering. And these crowds, people are supposed to be booking. That's what I understand. You're supposed to even book before you reach the office. And it's because of the rush. The time frame has also been extended. But it's not within the responsibility of PTF to say, look, you have to stop this, because at the end of the day, there were reasons behind why both the Ministry of Communication as well as Mr. President feels that it's a very important exercise in terms of keeping our country safe. But it's got to be done in a COVID-safe manner.
Okay.
That is the underlying issue, and that's something that we will continue to have.
All right, so I'm told I have to go on a very short break. We'll come back and continue this conversation. Stay with us, we'll be right back.
Thank you.
Stay tuned.
Thanks for staying with us. So we still have Dr. Aliyu with us. Dr. Aliyu, my question to you is, many experts have said that it would be wrong for Nigeria to do a full lockdown, especially because it will hurt us economically. We can't survive another lockdown, especially in the major nerve centers like Lagos, Abuja, Port Harcourt. In your view as PTF, what are your thoughts on this? I mean, especially now, this morning or yesterday, ASU was saying that they were going to have to postpone the resumption for schools. In your view, do you think we actually need a lockdown? And can we even survive another lockdown?
So just to clarify, no decision has been taken on a lockdown yet. And there's very little appetite for a lockdown, whether it's with the PTF or anybody else. We know the impact this will have on the economy. A lot of our people have to go out on a daily basis to seek their bread. But what we've been saying repeatedly is, because all of us don't want a lockdown, we need to make sure that we do not reach that stage where it becomes inevitable. If we have a situation where our hospitals are overwhelmed, our health system is breaking down, and people are dying from COVID or from other illnesses because they cannot access medical care, no responsible government will sit down and allow that situation to continue. And the only way for us to stop getting to that stage is really to respect the protocol. Wear face masks, keeping your social distance, washing your hands, and having a heightened sense of awareness of the risk of COVID-19. And that's what we're actually trying to prevent. We're trying to prevent overwhelming of the health system. And a lockdown is not going to be decided by the PTF. It's going to be decided by the behavior of the public when it comes to these rules. We have countries abroad. We have countries abroad that have very strict non-pharmaceutical intervention measures. Everybody follows it, and because of that, the economy is open. Their shops are open, their flights are coming in, their airports are busy, etc. But they don't have a COVID problem because everybody has to observe these rules. So in those instances, nobody talks about a lockdown. But we definitely don't want a lockdown. The only thing I would say is, because we don't want a lockdown, we need to make sure that we do whatever we can to prevent ourselves from reaching that stage when government has to take action. With regards to the schools, I just wanted to clarify. What the Minister of Education said yesterday was that they were going to review the date. He didn't say that they were going to change the date. He said they would review the situation and then let the nation know. So for the moment, it's still 18th January until the Ministry of Education comes back either with an alternative date or reconfirm that.
Okay, Dr. Aliyu, I just want to take us back to NIN registration and the crowds at the NIMC offices. And for me, I think what worries me or concerns me is I expected to, like a sense of outrage from the PTF. I mean, people are gathering in such large numbers, and we're hearing of medical personnel passing away due to COVID-19 infections. And it just seems that if the people at the front lines, in hospitals, at clinics are doing their part, no one else seems to be doing their part. And I feel that government needs to be even more angry. I mean, the part of government in charge of making sure that COVID-19 guidelines are followed needs to show more anger. We also need to show you know, going back to also Wike's question about sensitization, it just seems to me that to say, well, just when you get there, just make sure you follow the protocol, wash your hands, wear a mask, and what's the word now? Distance, and social distance. But there's no one place that you go to that you see that it is enforced there. It is advised, it is recommended, but it is not forced on them. If it's so serious that way, that is the only way Nigerians will understand how to, if government takes it that seriously, that's the only way Nigerians will understand this is a big deal. But it just seems you can get away with not following the guidelines in one place, but you then in another place you shut down some people for not doing, you know, like like they have to suffer the consequences of other people's, bad behavior.
And to help.
So, as I said, we've been working closely with NIMSI and the Ministry of Communications. The issue they are having is outside their premises, and we insist that those protocols that they have should be followed. In the first instance, people are not even supposed to go to their offices until they have booked. Once they book, I don't know whether you've been inside the offices or not, but in actual fact, inside the offices, the protocols are strictly followed. People should not be presenting themselves without the necessary booking. They should follow the protocols that both NIMSI and the Ministry of Communication have set up. But in terms of outrage, of course, we are not happy with the crowds that are forming outside. And we have reached out to the Minister of Communication. We've insisted that our protocols should be followed, whether in or outside the building. And they should make sure that there are enough law enforcement agents to control that. And in situations where this has happened, we've asked them to close those offices, and they have been closing them. But at the end of the day, their main responsibility, which is within their premises, they have to respect the protocol.
Right.
Outside their premises, they need to make sure that people are not presenting themselves in a situation which endangers them. But no doubt, of course, nobody is happy with what's going on at the moment. And whether it's in the NIMSI offices or it's a party somewhere on Bar Beach or whatever, the PTF will continue to push for people to respect the protocol. Persuasion works, but we are now reaching a stage where we are tired of persuading people, and we have to go down the law enforcement side. And as you've seen, both in FCT and Lagos, we have been pushing the state government to do a lot more to put in place enforcement measures.
All right.
This is the same discussion we had back on Thursday with the state government, and we expect that the glove needs to start coming off, really.
Okay.
Unless people are forced to comply with our protocol, the numbers will continue to go up.
Right.
Let me quickly ask you these two questions, because your answers are always very long. The front page of The Nation today, I saw a school that had started, they had started resumption in Oyo State, I believe. And the children were wearing masks, but their masks were not covering their noses on them. Even the teacher, his mask was covering his mouth. How are you going to ensure, if you start schools again, how are you going to ensure that the children, because they're children, they can wear the mask and then wear them on their chins or wear them on their mouths. So I see a lot of people with their masks on their chins. How are you going to ensure that people wear their masks? One. Two, people coming from abroad. And somebody complained to me that when he paid his 50,000, and when he got to the place to do his test, the test place did not exist. How are you going to ensure that these people actually get their tests done if you go to a place and the test place does not exist? Right. So his 50,000 gone, test not done.
Right, okay.
So our travel protocols are very clear. We have been trying to enforce them. It might interest you to know that in the last few weeks, we have been taking necessary steps. In the past, only about half of people even bother to go onto the portal. And of those that pay, only two-thirds actually go for the test. Our testing laboratories are very clear on the system. There are also contact details. We've also started giving passenger information leaflets now to people leaving the country, because the majority of those that leave the country do come back. So we're giving passport-size leaflets that provide information on our travel portal and what people need to do on their way back into Nigeria. And it gives people enough time to be able to go onto the portal and check. Anybody who has a problem with a laboratory test a testing center or a sample collection center, because in some of the cities, what we have are sample collection centers. We don't have the actual laboratories. The laboratories are only in some of the states within the country. I think about 5 or 6 states. The rest are all laboratory collection centers. But nobody will pay his money and fail to have the test. If that happens, they should reach out to us immediately or check the information that's available on our portal and reach out to the lab. And if there's a problem, it will have to be addressed. They paid for the service, and we expect the private laboratories to provide.
Dr. Aliyu, we have very little time. Dr. Aliyu, you have very little time. Thank you for answering the question concerning laboratories. But there's an issue on oxygen availability across this country. What are you doing to support the states in providing enough oxygen to support those who are critically ill?
So very true. We've already asked the state governments to reopen all their treatment centers because a lot of states have closed them simply because there isn't enough demand per se. We've also distributed, in the last few months, we've distributed a lot of what we call oxygen concentrators across the country to hospitals and medical centers. Now it's the time to open those oxygen concentrators. Even the U.S. government have provided, I think, about 200 plus oxygen concentrators and ventilators, more of the concentrators than the ventilators, including training. So now is the time to bring these machines out, remove them from their packaging, and use them. From the national side, the federal government has just approved the release of funds to provide, to set up an oxygen plant in at least one in each state. And each oxygen plant will be capable of generating up to 60 cylinders of oxygen per day. We've also done an assessment of the existing oxygen plants to find out what the maintenance requirements are. The money for the FCT for the 5 hospitals that have oxygen plants that are not functional has already been released, and we expect them to expedite this process. Oxygen, together with steroids, are the only two things that have been shown to be effective in improving outcome among patients with COVID-19. They are the only two things. And just to clarify, earlier on I said there's no drug that's been known to prevent replication. What I mean is to stop the replication of the virus. In terms of prevention, vaccine is still an effective option available.
Yes, so what are you doing about the vaccine? Most countries are ordering vaccines. What is Nigeria doing about the vaccine?
So Nigeria is working through the GOTV as a multilateral partnership to make sure that we have vaccines available as soon as possible. It's really critical that we are not left behind. Otherwise, Nigeria could potentially end up being endemic for COVID, and nobody would want to come to Nigeria for business, and we will have issues going out as well to other parts of the world. So it's critical, as the head of the primary healthcare agency said a few days ago, they've already secured about, I think, 100,000 doses by the end of January to sort of flag off. So this is really a symbolic gesture, because the main and the key amount, which will be 20% of the population covered, that's about 42 million persons, will come in towards the end of the first quarter, and this will be free from GOTV, but the government will need to provide money for the operational running costs. And within the same year, within 2021, government is expected to buy an additional amount of vaccines to cover 20% of the population. So by the end of the year, hopefully 40% of the population will be covered, and in 2022, an additional 30%. But what I wanted to say is the key challenge we're going to have, of course, is the acceptance of the vaccine. And primary healthcare have been working with other media agencies. There will be a lot of radio jingles, community engagement activities, volunteers, mobilizers. They will make use of the experience they've had with the polio campaign to start addressing some of the misinformation that's been out there in terms of the COVID vaccine. Okay,
we have to wrap up. Thank you so much, Dr. Ali. It's always a pleasure having you on the show. I think just
thank you for having me.
Adding a bit to what Mariam has said, maybe we like a PTF that is a bit more, maybe I don't want to use the word aggressive, but maybe show some demonstration of I don't want to use anger, is not the word. That your displeasure with the crowd you're seeing. So maybe your posture must be a bit stronger than what we're saying. Maybe that will help Nigerians get the message better. Suggestion.
We really take that point, and we'll take it forward.
Thank you very much. All right, that's all we can take. We have to go. Nima, 2 seconds.
No, there's a
Oh, wait, wait.
tweet. It's spoiling.
Okay, we have to run. All right, we're going to when we come back, we'll discuss the issue of detoxification, no, deworming. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.